Hello and good evening, Instagram followers. I am Dr. Ellen Wood of IVFMD, and tonight we're going to be bringing you, along with Dr. Farrar Duro of Florida Complete Wellness, a Q&A. We've had some questions submitted earlier, and then we're happy to entertain questions that are submitted during the 1 hour we have on Instagram tonight. I think I just pushed the correct button. So I just like to introduce myself. My name is Dr. Ellen Wood. Hey, so
Happy Wednesday.
Happy Wednesday. Welcome. All right, I have successfully had you join. So I'm just going to introduce myself. So I am Dr. Ellen Wood. I am one of the physicians, the 12 physicians we have at IVFMD. My main office is in Broward County. I'm in the Cooper City office. I've been with the practice for the last 22 years. And I am happy tonight to answer questions that are submitted on fertility. Dr. Duro is here. I totally believe in alternative approaches as far as complements to our traditional fertility treatments. And so Dr. Duro is here to answer those questions. We've had some questions submitted earlier earlier today from Instagram. And again, we've been partnering with Dr. Duro for a couple of years now, actually a long time. And again, we really endorse the complementary type of treatments in my practice. I think they can add something that traditional medicine cannot. I think the majority of our physicians do endorse these type of things. I know you've done multiple Instagram lives with different physicians in the practice. Again, I'm in the Cooper City office in Broward County, so that's the main focus of my practice. So Dr. Duro, introduce yourself, and then we'll get started on the questions.
Okay, thank you. And I appreciate your approach throughout the years with our mutual patients. I think it's so great to have that integrative approach, since we know that infertility is not an easy condition, and it takes a village, as they say. So it's really important to have those people that you can trust and work together with for the mutual good and outcome of our patients. So and I know from the beginning you've always recommended acupuncture. I think that that's excellent. And my name is Farrar Duro. I'm a licensed reproductive acupuncturist. I'm in Hialeah Gardens, and we work with patients from pretty much all over Miami, Broward, that area that are struggling with getting pregnant, and also during pregnancy as well, with nausea, back pain, migraines, things like that. And we also work with their partners as well. Somebody asked this week, like, do you only work with women? And we're like, well, mostly, but we do work with the guys too. Like when we can get them to come in, we will work with them. And so that's where we kind of bring an integrative approach, doing nutritional recommendations, acupuncture, massage. We have different types of abdominal massage, things like that we do. And we also go to your office in South Miami now for the transfers as well, to do acupuncture during the day of transfer. So yeah, that's great. And I'm excited to jump into some of our questions and welcome you guys. There's an acupuncture question already. Yes, for anxiety. Actually, I was going to bring that up tonight because there was a question about anxiety, and it's rampant. We have so many patients with anxiety since COVID started, actually. And you and I, we were doing these lives when everyone was in lockdown, and yeah, and it was, and everybody had no idea, what was going to go on. So that the anxiety definitely has been heightened, I think, since all of this started. I know that it's also a lot of times with infertility, like the uncertainty of everything. You're not in control of your own body sometimes when you're going through treatments. Everything is manipulated for a reason. So that's really hard, just to say, okay, just go with the flow and don't look on Google and everything will be fine. So we do work a lot with anxiety. It's built into acupuncture treatment. It's a natural side effect, thank goodness, of relaxing the sympathetic nervous system when we're doing approaches like acupuncture. Yoga is another great one we recommend for anxiety. And there's also some plant-based treatments you can do as well that are very helpful. Ashwagandha, which is an Ayurvedic herb, is really one of my favorites too. We do. So we work a little bit, definitely with combination approach, but most of the time, the anxiety can definitely be a hindrance if you're, trying to go through an IVF cycle. We want your cortisol to be nice and balanced and low if possible. And when we look at patients with high cortisol, sometimes it can interfere with the outcome in some studies that you look at. Everybody has stress, but it's just too much sometimes at once is enough.
Well, it's interesting. I mean, it makes kind of intuitive sense that if you're stressed, your body cannot, the blood flow cannot be proper. Your adrenaline is high. I mean, it's very, very interesting how stress combines. I was just on a meeting last night, and the Inception Network, that is the parent network to IVFMD. We've got multiple different clinics, 130 different physicians all over the country, and they are starting a study looking at, we're enrolling patients, so we're going to start to get material soon, enrolling patients, looking at the role of anxiety and how it plays in an IVF outcome. And, it's something that intuitively makes sense, but we don't really have like super great data, So it would be nice to do kind of a multi-center study, in order to just analyze this, and then the interventions. So that's the thing. It's like, people say, I'm so nervous. I can't prescribe you anti-anxiety medicine. That's the problem. Because we know that harms eggs and harms your fertility. So we need to really incorporate these alternatives, acupuncture treatments, meditation, yoga. I mean, all of these things, because, these are things that you can do without putting something into your body that could potentially harm your egg quality, which is, very, very key to our success. Now, on the flip side, sometimes patients, they are afraid of needles. Or there was a study done, I'm sure you're aware of it. It was done out in Seattle, and the patients had to travel like an hour back and forth in traffic.
Okay.
Okay. This was not helping them before their transfer. I mean, the traffic was inducing more anxiety. They're going to be late for their transfer after they did their acupuncture. So that is why I think it's so generous, let's go, of you guys to come to our clinic and give them the acupuncture while they're on site, so they're not driving in Miami traffic an hour this way, an hour that way. I mean, it totally negates the whole purpose.
Yes. And hopefully that study actually was done like for the post-transfer treatment, and so we definitely get people asking, can I come in for acupuncture after the transfer? And we're like, no, wait like 4 or 5 days and then come back for your treatment, but just go home and relax. And and I see Carolina chiming in. I'm so excited because I got to meet little Gia. Actually, she's 10 years old now, but I gave her an acupuncture treatment yesterday, and I'm like, oh my God, it's been like 11 years since since we're treating her mom. So for fertility, but things go, time passes, but definitely the whole issue with stress is just one of those things where it'd be great to have some research behind it and say, like, we know out in, when in zoos, and animals will not breed sometimes if they're under stress. So they end up doing IUI for, zoo animals and things like that. So because the sympathetic nervous system is in fight or flight, it's trying to run from something. That doesn't make sense to want to get pregnant. The body knows that it's not right, So I think it makes a lot of sense to study that. And we do check cortisol levels in urine. So we have a urine test called the Dutch test. It actually can do an adrenal profile. That is a 24-hour cortisol profile. So we can see how the body's responding to stress prior to doing, any kind of types of treatments as well. And so we can know, like, the one that we see the most issues with are night workers, like night shift workers. That does a number on the HPO axis. It is not great for cortisol. Sometimes it's so high it doesn't even register. The cortisol is like through the roof. So we work with that. We can't change the job, right, if you are a night shift worker, but we can help hopefully the body respond a little better. And those drugs that you take for fertility treatments, they need the brain to cooperate with the ovaries. So that's kind of the role of acupuncture and how it helps with the stress and also fertility too. So
Right. Well, again, one of the questions just popped up to why don't clinics give out mental health resources during treatments? I mean, we have a long list of different basically psychologists that are trained, well versed in fertility. We actually just got another email from somebody who's just kind of started a practice, moved into the area, trained in reproductive health, to really work with patients with reproductive psychology, because it's such an emotional issue. I mean, I think the amount of patients that have come and they've not gotten pregnant because they're so afraid something's wrong. Okay. I've just done the basics. I mean, I'm just saying, let's see if anything's wrong. And I like, you know what? There's nothing wrong. And now they are so relieved that they know there's nothing wrong. They go and get pregnant.
Yeah. Right.
Like, no, you look great. Go get pregnant. And because they were so, it wasn't happening, and they're like, oh no, okay, finally, and they give in, like, yep, I'm gonna make an appointment with the reproductive doctor, like,
Yeah.
We're gonna go see her, and then because people are afraid. I mean, like, it's kind of like, you feel a lump in your body, like, I don't want to go to the doctor, I don't want to know if it's cancer or not.
Right.
It's the same thing. It's I don't really want to see the fertility doctor because the fertility doctor is going to tell me there's something wrong, but then when the fertility doctor tells you there's nothing wrong.
And as I explain to people, it's not that you're going for IVF. Like, you are going to get evaluated. You don't know yet what's going on. So it's not usually the first go-to treatment that you guys do. Sometimes it is, sometimes it's not, but it's not,
If you have a bad sperm count, you need IVF. You have blocked tubes, you need IVF. Like, I mean, there's certain conditions that, there's no way around it. You need IVF. But then the most frustrating conditions are the patients who come to IVF, and I'm like, look, we did this, we evaluated you, we tried this. I'm like, I got nothing else to offer. I mean, I'm not saying you won't get pregnant in the next 6 months to a year to maybe 2 years, okay? However, you want a baby tomorrow, so let's just do IVF and get you pregnant. And then the greatest thing is, in a lot of patients, and I know you've seen it, it's like, you get them pregnant with IVF number 1, you turn on the baby machine.
Yeah.
And then, you bump into them in Target 5-6 years down the line, they've got 3 kids, and you're like, where'd the other 2 come from?
Exactly.
Like, you went to another clinic and made those babies. I haven't seen you for 5 years, and this one just came, popped out. Like, I was pregnant and this one just came. I didn't know it, I mean, one of our patients is now pregnant. And it looks.
Yes, I know. Yeah.
That was 2 IVF babies. One of our mutual patients is pregnant. Like,
yes. Naturally, I was very excited to hear that. I was like, I know Dr. Wood's so excited for you. That's awesome.
He looks great, but that's after 2 IVF babies.
Yeah, the body knows sometimes what to do. I mean, that's amazing.
So it's sometimes even, that first IVF pregnancy, it's just like to get it done. And then, if there fundamentally wasn't anything wrong, again, we're not dealing with, again, low sperm count, if we're not dealing with blocked tubes, if we're not dealing with some sort of anatomical issue, things like that. Sometimes where kind of the psychology of fertility comes into it. It's like, you're not paying attention to your fertility anymore. You're taking care of your baby, and you're trying to take care of your husband. It's like, oh God, I'm pregnant.
And sometimes, yeah, so when you least expect that, my cousin actually delivered me and my brother. He's an OB long practice. Well, he's retired now, but he used to say, like, the best cure for endometriosis is having a baby. So that was like, what he would stand by it. So.
Pregnant the first time. That's sometimes the tough, the difficulty with patients with endometriosis is because their body, they can have so much inflammation in their body. There's so many issues with endometriosis. I mean, to actually connect the sperm and the egg in the laboratory is what helps. And then we put the embryo back and they get pregnant, and then that turned on the baby machine, because the pregnancy itself burned out the disease. A lot of patients, unless they have significant anatomic distortion. So that's where pregnancy and endometriosis really can come into play together.
Wonderful progesterone. That's good. Good for you. There are a few questions I think about, I guess, popping up. I think I did see some of them, but now I see it here. Okay. I don't know if we missed. Oh, yeah. Okay. You got, the mental health thing. And also, is acupuncture good for PCOS? So
Oh,
you can answer that question. I know you have experience.
yes. So PCOS, I'll give my little medical take on PCOS. So PCOS, it is such an interesting condition because there's certain criteria that we use to diagnose it, and there's other criteria that are associated with it. Okay. And there's so many different metabolic things that go on in the body in order for the brain and the ovary to work. So in general, polycystic ovary patients have a lot of eggs. And because they have so many eggs in their ovaries don't respond well to the normal natural signals that the brain sends out. So you have to try to make the ovary more sensitive, okay, to those signals. So what we do with our medications is we increase the signals. So we make them stronger. So we basically, instead of the brain talking to the ovary, say, hey, ovulate, the medicines make it shout at the ovary. Or we give you injectable medicines that like the ovary can't ignore. Okay, so that's what we do. But there's lots of other things that can be done from a dietary standpoint, from a blood flow standpoint, from a weight loss and estrogen, losing weight, and you lose fat, not just weight because you want to lose muscle, but you want to lose estrogen because estrogen secretes hormones that will suppress the way the ovary responds to the brain's hormones. So again, weight loss, exercise, diet, blood flow, all of these things contribute to the way the ovary responds to the brain signals. Again, what I traditionally do, I make the signals stronger. Okay. But when we add in our complementary treatments and we look at lifestyle and metabolic issues, those issues specifically address the ovary and making it respond better to the signals. So that's where, again, acupuncture comes in. I mean, I've had patients who, again, we've given them traditional medicines, the cheap stuff, fertility pills. And again, they either didn't have the money or didn't want to move on to in vitro or injectable medicines. And, they've come back to be pregnant. And I'm like, okay, who did that? And they're like, oh, the acupuncturist, got my ovary to work, so there's, and it's all about how the ovary responds to these signals the brain sends out. And there's so many different things that go into an ovarian response. So that's my take on PCOS. Again, traditionally and again, non-traditionally, but I try to do, complementary things. So, I'll have patients, if they have high insulin levels, I'll lower their insulin levels. That'll make their ovary more responsive. We will give them medicine, supplements like ovasitol that will make their ovary respond better. Again, as far as metabolic issues are concerned. So there's lots of these different things that can help the ovary respond.
Yeah. Well, for sure. Exercise. People are scared of exercise, actually weight bearing exercise with PCOS because they're thinking, oh, it's going to bulk me up. My testosterone's going to go up. It's like, that's actually the opposite that's happening in PCOS. So it actually can help 30 minutes a day of actually HIIT training is actually shown to lower testosterone in PCOS patients. So, but it's all about, that insulin resistance, trying to work with that. And I think that's the great part about having the nutritionist right there to communicate with the reproductive medicine doctors and your acupuncturist. It's PCOS definitely, it does take a good team, I think, to really. There are some very, very difficult cases I know you've had where it really is hard, and then there's some that are like there's a full spectrum of PCOS that are not as difficult, but it definitely can help. There's a lot of studies with electroacupuncture. That's generally what we try to use. So most of the research is done with like a little device that attaches to the acupuncture needles. It's going to stimulate the points around the ovaries and also the points on the sacrum. So those points in the sacrum actually can influence the nerve endings that actually connect to all innervate the uterus and the ovaries. And they use a Doppler and they can measure actually more blood flow to the ovaries. So there's a scientist that did this. I think she's in Austria. I can't remember, but or Germany. Can't remember her name, but she actually studies PCOS and acupuncture. So it's really interesting. When they found that blood flow increased, they actually found that the ovulation actually occurred more frequently. So that's the acupuncture part, but there's many different facets, like you said, the exercise and nutrition, stress, because anxiety, depression, they're a little more common with PCOS than in the general population,
Absolutely. That those studies have been done, but again, it's a vicious circle.
Mhm.
You're overweight, you're not feeling good about yourself, things like that. And again, with PCOS, I use two different approaches when a patient comes to me as a physician for PCOS. I'm like, do we want to get pregnant or don't we want to get pregnant? Because there's two different pathways to go. Okay, so if you want to get pregnant, we have to focus in on fertility and focus in on ovarian function. If we do not want to be pregnant, we have to focus in on hormones, because hormonal imbalances that PCOS causes, okay, are going to cause a lot of the symptoms that the PCOS is you know, that this hormone imbalance is going to cause your PCOS to cause this symptom or that symptom, that symptom. So when I speak to a patient who's not trying to get pregnant with PCOS, I go, all right, list the complaints. Okay, let's go through them one by one. Okay, let's see and let's prioritize them. What's the main problem we're having? What's the secondary problem we're having? What's the third problem we're having? And let's address them one by one and see how we can fix these, okay, from a medical standpoint to make your life better.
Yes.
Okay. And the other interesting thing is weight is so important. I mean, we'll have patients who, you know, lose 10 pounds and they start to get regular periods. They gain 10 pounds, their period goes away.
Yeah.
It's so, I mean, it can be that different. You know, I'll have a patient who, you know, basically has PCOS, but got pregnant on her own with her first, and then now she's having problems, and she comes to see me and I'm like, is your weight the same? She's like, oh no, I'm about 30 pounds heavier than I was when I had my baby. I'm like, bingo. You know, instead of giving you fertility medicine, we need to focus on how we can lose these extra 30 pounds.
Definitely. And I found B12 very helpful. Actually, we have a lot of patients that are, they get B12 injections because they are on metformin, which can deplete B12, and also birth control as well can do the same. So that can, I mean, when we check their levels, it looks a little low. So that's something that can also help with regulation of many things and helping with that insulin sensitivity and energy and wanting to get out there and start exercising. So you're depleted, you're anemic, you're D deficient, vitamin D deficiency we see all the time. And then you're B12 deficient. It's just like, well, you know, like we can tell you to do stuff, but you're not going to have the energy to do it. Or your thyroid sluggish. That's a big one, you know.
Interesting thing about the B12 deficiency is that a lot of vegans, I mean,
yeah,
they're, you know, they go to a vegan diet because, you know, think it's healthy, blah blah blah, and they end up vitamin deficient, because especially B12 deficient because of what, you know, what they've changed their eating patterns to.
Yeah, definitely. We try to encourage a balanced diet, and it's difficult. I was vegetarian 10 years. I have PCOS and it whacked my insulin out. It was horrible. I mean, not to say that for everybody it happens, but in college I learned that that's not the way I need to be. I started eating a little fish, felt better. And obviously it took a while for me to get pregnant. I used acupuncture nerves that ultimately worked. But you know, sometimes you just have to, you know, figure out the hard way. And back then, not very much was known about PCOS, except for just take birth control, which not great for me. So, so I think, you know, learning your body is really important. Getting that blood work done with a nutritionist. Well, we do the same with acupuncture. We look at all the nutrient levels, and let's say, you know, looking into that, that's important. And getting on a good prenatal, like you talked about, with methylated folate. Although some are better than others, the gummy ones, I'm not sold on those. A lot of people have those gummy vitamins. I don't know. How could they have everything in them they need? I'm not sure.
I just recommend quadrifolate or methylated folate. I mean, the only prescription that's over the counter, just make sure your prenatal vitamin has the methylated folate, and then I think you should be covered as far as, you know, protecting your baby from birth defects. One question is, Papa, do you accept Aetna insurance for IVF cycles? Absolutely. Yeah, it is one of the main insurances that we take. Not sure. I don't know whether they cover acupuncture or whatever, but we absolutely accept Aetna. So I just saw that one pop up. All right.
You don't need a doctor referral for acupuncture, so you can. We're primary healthcare providers in the state of Florida, so in Florida you don't need a referral to do that, to come in. So usually what we do is a consultation on the phone. It's like 10 minutes just to kind of figure out what's going on, what kind of treatment you're getting. Are you having a transfer coming up? What, as far as the scheduling is going on with your treatment and all that? And then we can kind of go from there. But that's usually what we do. And some insurances will cover acupuncture. We are in network with Cigna and Aetna, so it just depends on your plan. But it should cover it, right? Because Medicare covers it. So I don't know what's wrong with, the other companies. They'll eventually get on board. But you can always check with them too and see. I think that was all the chat questions. Is it okay to buy a prenatal on Amazon, or should I go to a pharmacy or drugstore?
Methylated folate.
I'm not big on Amazon on supplements, though. I'm not.
Ritual is online. I mean, Amazon sells Ritual, but just turn the bottle around, okay? Because most prenatals, they used to only have folic acid in them. Okay, folic acid is great. Folic acid in the 70s, they did studies that prevented neural tube defects 100%. However, there's a specific enzyme, okay, that in case your body can't metabolize regular folic acid properly, you're not getting enough. And the problem is, if you go to your doctor and you ask them for a test for this enzyme, your insurance charge doesn't cover it. It costs you like $1,000 for it, okay? So I've just abandoned testing for this enzyme because it costs too much, okay? So we can get around it by using a folic acid in your prenatal vitamin that gets metabolized, okay, directly. It doesn't need to be broken down. It gets absorbed directly into your body, and so you get enough. Because if you have this enzyme problem, only half of the folic acid that you're actually taking in a pill is getting absorbed, and this is where birth defects happen. I mean, I've had, unfortunately, multiple patients in my career that have had these terrible birth defects, spina bifida, anencephaly, cleft lip, cardiac defects. And when retrospectively we tested them, I said, look, I think it's indicated we test you to see if you have this enzyme deficiency. And certain enough, they did. They had it. And I was like, oh God, you cannot go without this methylated folate or quatrefolate in your vitamin. Now, it used to only be available prescription, okay? So it used to only be available prescription. So it's like you needed a prescription vitamin. Now, I'd have to say more than half of the over-the-counter products that patients are bringing to me and showing me, is this okay? Is this okay? Is this okay? And I'm like, yeah, methylated folate.
No.
Like, I think Theralogics makes a prenatal. I know Ritual makes a prenatal. These are all over vitamins. But all you got to do is turn the bottle around and say, does it say quatrefolate or methylated folate? And you're good. Even if you have this enzyme deficiency, no worries. You're getting enough folic acid.
Yeah.
But this is gone. I mean, I've been preaching this for, 15, 16 years now. Really gone unrecognized, even by the obstetrical population, that there's a difference. Because again, we're schooled, and even the ACOG, documents to say, oh, you just need to take a prenatal with folic acid. Well, again, it's not that simple. It's not that simple because of the way different people are making out. And it's the same thing with mercury, okay? Mercury is fascinating poison, okay? Because there's some fertility patients, okay, that they have an enzyme genetically that they can't metabolize mercury, okay? So it's something that can get tested by a functional medicine doctor, but they can't metabolize mercury. And they come back into us and a couple sushi rolls will cause them to be mercury toxic, okay? Because they miss an enzyme in their body that can't metabolize mercury. Now, if you have this enzyme, you can eat as much fish as you want, and you're never going to become mercury toxic. So, what you're born with is pretty much your destiny. So, you're born with something you can't metabolize folic acid. If you don't take something that you can metabolize, yes, you could have a baby with a birth defect. You can become mercury toxic, and it can really mess up your reproductive system if you have this enzyme and you're eating fish every day. But some people can eat fish every day with no problem. So, I mean, there's lots of these little deficiencies that, again, it's very expensive to test for them. So it's just best to, avoid certain things or take a vitamin like the methylated folate that will get metabolized right away.
So you could test someone's mercury level and see that it would be elevated and perhaps think that they maybe have this, or
yeah. Elevated mercury level screws up your fertility.
Oh yeah, for sure.
Oh my God, especially like I had a couple, she was married to a fisherman, okay? And actually they were having all sorts of weird symptoms. They ended up going to a functional medicine doctor one of my friends, she's in Sunrise, and she tested their mercury levels. They both mercury levels were off the wall. Like, high. But yeah, because they were eating what he caught all the time. You know,
Yes. Yeah.
he was, catching, tuna, mackerel, kingfish, shark, sword, big fish that eat little fish. Okay, I mean it's tasty fish. If you have elevated mercury levels, it can damage your sperm. It can damage your eggs.
Yeah, for sure. Well, there's a big trend to eat lots of fish with the men.
That's the thing about the fish. It's like, eat lots of fish again, but then you're poisoning yourself.
Right.
So you have to, you have to kind of look at the type of fish that you're eating. And again, also be cognizant that if you're eating fish on a daily basis, you may want to get your mercury levels checked, because elevated mercury is clearly associated with reproductive problems.
I actually have a very good friend who took a brand of prenatals which had mercury in it and didn't know her child actually had autism. So there was a class action lawsuit against this distributor. So, and it's something that she got it online. And I mean, that's why I'm a little nervous about Amazon and many things. I like pure encapsulations. I like brands that are actually,
They have the testing, the data. I mean,
they are third-party tested, they're pharmaceutical grade. That's really what would be emphasized. So, yeah.
I mean, again, but I think Ritual also does seem to have the testing and the data behind them. So, but if you're on a vitamin that is agreeing with your body, I think that to stick with it. I don't think there's a reason to change it. If it has the nice absorbable vitamins in it, and it's agreeing with your body, I don't think there's any reason to change it. Because a lot of people have GI issues and different issues, especially when we're talking about the DHA and because that's again supposed to be better for the baby's brain and things like that. But again, that's the derivative of fish oil, and some people don't tolerate that great.
Yeah. And someone asked, should they switch out their prenatal if they've been taking the same one for many years?
If you're tolerating,
yeah.
It has the absorbable vitamins in it. I don't think that I would.
Yeah.
I think it's just a good idea to just kind of stick with it as long as you're on a regimen and you're taking. All right, so we had a question here that was interesting, and it's about a high estrogen level. Okay, it says FET canceled due to estrogen level too high. What to do next? Well, first of all, we have to figure out why the estrogen level was too high. That's the first thing. So we've looked at estrogen levels and uterine receptivity. And if estrogen levels are too high, it can cause the uterus not to be receptive to the embryo, which is why we get kind of nervous when the estrogen levels get too high. However, they have to be really, really high to cause significant receptivity issues. Usually when we make the estrogen levels high, we're trying to thicken the uterus, the lining. You have to weigh a thin uterine lining versus a high estrogen level, because a thin uterine lining may lower your chances of getting pregnant, but a high estrogen level may lower your chances of getting pregnant. But the reason the estrogen level is high is to thicken the lining. So it's really challenging when you have a uterus that doesn't want to grow super thick, at least a 6 or 7 millimeters, versus getting their estrogen level too high. So there's definitely different approaches to this. Different ways that estrogen is absorbed, different ways to stimulate a patient's cycle. I mean, sometimes when I've had this situation myself, I have actually reverted back to what is very logistically difficult to do in many cases, is I've reverted back to a natural cycle. So if a patient is young, she's having regular menstrual cycles, we change from the regular controlled frozen embryo transfer cycle, which we do for 90% of our patients because it works fine. And we change back to, well, what does your body do? Okay, so what does your body do? Let's see if you ovulate. So you ovulate, your estrogen level's 200, your follicle is nice 20 millimeter follicle. We trigger your follicle and let's put back your embryo a week later. We just go with what your body is wanting to do. You can do it naturally, You can use Femara. I've had some patients where I've actually had to use injectable drugs and induction cycle. But I've used that as an alternative to just the traditional frozen transfer cycle and sometimes when you just give patients estrogen pills and patches, their lining doesn't thicken up. So then you give them more estrogen pills and more estrogen patches, and then their estrogen level goes off the wall, but their lining doesn't thicken up. So, there's many different approaches to doing these frozen transfer cycles. There's obviously the traditional approach, but if it's not working well in the traditional approach, there's different alternatives you can always entertain.
And everybody metabolizes hormones differently. That's, that's why we're all unique.
I have a patient who I'm giving her oral estrogen and her level's like 100. Well, we wanted about 200. That's what we're looking for, physiologic. Okay. You take one of those little estrase pills and instead of her swallowing it, you put it in her vagina. Okay. Her estrogen level goes to 1,000 and you're like, that's a little too high. It's like she put it in her mouth and it was low. You put it in your vagina and it just got absorbed like gangbusters. So there's always a balance to how much to give and where to give it and how it's absorbed. And every patient's different. Every patient is completely different. So most patients behave like the book says they're supposed to.
Yeah, and if your gut function is off, then that's going to, also influence, and your liver is sluggish, you could, have problems metabolizing medications as well. So that makes sense that person could have responded. I've heard people doing metformin that way too. So, yeah.
That's a new one.
Because if they're not tolerating it very well, their nausea and all that, they actually do pretty well with that. So
that's a new one. I learned something. I'll next patient who complains of GI upset and orally, I'll see if they can tolerate it vaginally.
There you go. Let us know how it works.
That is great. I've tried we use Dostinex, we use bromocriptine in the vagina. Growing up where you're sick, you put your birth control in your vagina and absorbed in it when it works, you're still protected against pregnancy. But metformin, wow. That's a new one. I'm going to put that on the recommendation list. The next patient I have that says I can't take my metformin. I'm like,
it could be terrible. Some people just they get off of it because of the symptoms. They just don't want to.
A lot of people get off. And I think metformin will help your ovary respond better to fertility medicine. If you have PCOS and high insulin levels, but I'm not here to torture you.
Yeah.
If you have PCOS, so you can't take the metformin. I don't want you to run into the bathroom every single time you take the pill I told you need. So again, I don't really push the metformin if somebody has a lot of illness to it.
Yeah.
Because again, I'm trying to help you get pregnant, not make your life miserable.
That's right.
But cool. I'll try that.
And I think we had a question about the next question was about acupuncture, that she has anxiety. She's been doing acupuncture. She's not seeing any changes. So, and we don't know if she's in the middle of doing IVF or what type of egg quality testing she's having, because it's hard to test egg quality unless you're doing IVF. There's not many tests that can show that, but AMH is debatable too. Like if that really, some people have low AMH, but they have good egg quality too. So I guess, in that case, it's something I wish that we could say that it worked 100%. It doesn't. Everyone responds differently to different modalities. And so, but I would definitely make sure you're being supported as far as having a therapist. That anxiety is not being helped by acupuncture. It's probably pretty severe. I find that mild to moderate anxiety does usually respond within 5 or 6 treatments. It's cumulative. We try to actually have people come a little more frequently if they're anxious, because of that flip, that sympathetic to parasympathetic nervous system flip that needs to happen, where they're not in fight or flight mode. And the cortisol does take time. It doesn't automatically just fall down within a treatment or 2. So just make sure you're giving it time. I also would like to know what kind of acupuncture you're getting, because in some cases we've had patients who have only had face-up acupuncture, which is interesting because that to me is actually is actually kind of half of the treatment. Like we do a lot of face-down treatments. There's a lot of calming points for anxiety on the back, and a lot of great reproductive points on the back. So just make sure you're trying that, just try it first and see, maybe ask your acupuncturist about that. And auricular acupuncture. There's ear seeds you can do. There's we leave those seeds in with our patient. I'm sure you guys have seen it when we do the transfers. They have little seeds in their ears. Actually, that's part of the IVF acupuncture protocol that's been done for many years, but that's because they're relaxing. Those points are actually relaxing the nervous system, and those points are usually kept in for 4 or 5 days. So you can actually use that to help with anxiety as well, in addition to the acupuncture. So auricular therapy. So yeah, and definitely do not give up, because what we see is every cycle is different. So if you can, hang in there and try different things and find out what works for your body, then, then you'll, I also like ashwagandha. I'll mention that again. Like if you're able to do something that is, that's an Ayurvedic herb, but it also is good for reproductive health and anxiety as well. We recommend it even in, younger patients, and it's really something you can investigate, but like 500 milligrams twice a day. There's also nutrient levels. Check those, because what we see a lot of times when we talked about the B vitamin deficiencies and also, anemia and different things like that, those patients sometimes are very anxious. So, it could have some sort of nutritional component too. Diet is very important. So many things go into anxiety and how it influences your fertility. So, just, I would ask those questions, and remember that, I think, where there is a team that's able to help you. Like, you're not alone in this. We used to actually years ago have a little meditation circle with our patients. Like once a month, we would have patients come in that would actually, they all became friends. They all got pregnant. They still are in touch with each other 10 years later, on Facebook and all that. But they went through this together. So if you have someone going through the similar thing, or you can reach out to someone, it really helps, I think. Sometimes we'll just connect patients together, like, hey, do you mind if so-and-so reaches out to you? Because they're going through the same thing, the same time as you. And they end up just really, I think, doing better. Like there's definitely, some evidence on this too, that it improves outcomes. So yeah. And I think that was I don't know if there was another question about acupuncture. That might have been the only one that I saw, I think, but, or about frequencies maybe.
Why is there a weight BMI restriction for retrievals and transfers? Okay. So this is really important. Okay. So in our centers, we do our egg retrievals in our offices. We do egg retrievals in our Cooper City office, in our South Miami office, in our Jupiter office, in our Naples office. We have labs. Okay. Now, we're not in a hospital. So we can only do a BMI up to 40 for a surgical procedure, because we are worried about breathing and the airway. Mm-hmm. BMI is between 38 and 40. The patient has to see our nurse anesthetist to make sure that she's comfortable putting that patient to sleep, even though it's just conscious sedation, before we do the egg retrieval. However, I personally am very strict about replacing embryos, okay, based on BMI. We do not know how a BMI of above 35 or below 35 makes a difference. But the majority of some of these published studies shows that if your BMI is over 35, now, I personally have not seen it affect egg quality dramatically. I mean, which is kind of weird. I just haven't seen that. But if your BMI is between 35 and 40, we can retrieve your eggs. We can make you embryos. And I've made like hundreds of healthy embryos for patients with a BMI in those ranges. But me personally, I hold your embryos hostage, okay, until we can try to get that BMI and reduce your fat in a healthy way down to a BMI less than 35. because I'm not saying all the literature, but the majority of it basically says if you're, and it's probably has to do with body fat, and it really does, but if your BMI is over 35, embryos don't stick as well. Okay, but they don't. That's what it's most of the data says that. You have a higher miscarriage rate. Okay, so why would we want to go and make you with all this trouble and a healthy embryo? And if your body is not in better shape to receive the embryo, puts you at risk for it not to attach, or puts you at risk for miscarriage. Mm-hmm. It's frozen. It can stay frozen until you're healthy. Okay. I mean, you know, usually takes 3 months, 6 months to get healthy, but the embryo's not going anywhere. We've already made it. And the reason that I do it this way, I can't say everybody, this is just me, but the reason that I do this is because I know that age is more important than anything when I am making your embryo. Okay. We don't see, I mean, again, it's better to be, you know, healthier, obviously, but you know, I just don't see a huge difference if I do an egg retrieval on someone with a BMI of 37. I've made tons of healthy embryos, but I know if I give them back to you too quickly, you know, if we haven't gotten healthier, it doesn't work as well. So it's, you know, it's something that, you know, or if we've had a miscarriage or something and our BMI has been heavy, I'm like, look, let's get healthier before we put back the next embryo. I don't know. And no one's really identified like why. It has got to have to do with body fat. It really has to do with body fat. I mean, but again, there's not any great study done on it. So, but the retrieval restrictions are because of breathing, because we don't want you to, you know, die on the table. And the transfer are because, again, it doesn't work as well, and the miscarriage rate's higher.
There are a few questions. Actually, well, we have so many questions popping up now. We have our questions submitted.
Like, so there's a question that popped up that, you know, do we want to like, if she wants to transfer embryo to IVFMD from, she's in South Florida, we accept patients for frozen, we accept patients for frozen transfer all the time. All we have to do, that if you want to transfer your embryo to us, we just need the records on who made your embryo. And then what happens is those records go to our head embryologist, and they look at the records and make sure that you had the proper testing done when the embryos were made, your husband had the proper testing when the embryos were made, the embryos are decent quality, and then we're happy to transfer the embryos to our, you know, center and do a frozen transfer on you. So we do that all the time, as long as the embryos, you know, have all the testing that they needed done properly according to the FDA. And the other question was, Provera to induce my period makes me depressed and sad. Is that normal? Yeah, progesterone could be a bad drug like that. Different things you can do. You can take vaginal progesterone to induce your period. You can take a progesterone injection to produce your period. You can try prometrium, which doesn't make you depressed, only makes you sleepy to induce your period. There's lots of different forms of progesterone you can use to induce your period that won't make you depressed. So, got those. All right, what else we got?
Natural killer cells. Is it important to get tested before FET?
Well, okay, so let's think about it this way. A natural killer cell test is not a very expensive test. The treatment that we use for natural killer cells is not very expensive. But however, the treatment that you did to make the embryos can be really, really expensive. So I have had patients who I've done the natural killer cell test on, and they've refused the treatment, and they've gotten pregnant, and it's been fine. Okay. I've had patients who, you know, had one baby, the second baby, we fairly had natural killer. The first baby was fine. They're like, did I have this then? I don't know. However, when there's an intervention in medicine that is not incredibly burdensome, that is not dangerous, it's relatively inexpensive, and it's not going to harm the patient, and it has the ability, if we identify that your immune system is really strong, the treatment has the ability to maybe improve the chances of you getting pregnant or of your pregnancy continuing. Okay, I use a risk-benefit approach, and if the benefit is high and the risk is low, I think it's not a bad idea. Okay, but that's the reason. It's like, you know, do you really, really need it? Maybe not. Okay. Could it help? Possibly. Okay. Is it going to hurt me? Probably not. So, I mean, you've got to weigh. That's what I do. I mean, I weigh these different things. Now, if we're talking about a really expensive treatment or really dangerous treatment, again, that's a completely different story. But when we look at immunologic infertility, the problem with immunologic infertility and doctors, okay, we like, again, as I've talked about earlier in this talk, studies. We like studies to say, this is good for this works, this does, I mean, that's what we want. We want studies. We don't have a lot of studies when we're talking about the immune system. And the reason is it changes. It changes from day to day to day. It's like, you know, your immune system has been heightened alert, and it changes from stress, it changes from cortisol. So your immune system could be like super duper strong and you're not getting pregnant. And then, you know, different things happen in your life and your immune system chills out and you get pregnant. It's like, well, what happened to my killer cells? I don't know. They went away. I mean, you got pregnant. So yeah, no spin classes after IUI. No.
No, no, no.
No. Okay, because, okay, so, well, let's go back to spin classes here. Just no, I mean, because I spin class as a high intensity class. Okay, so high intensity exercise in patients other than PCOS patients, okay, in general diverts blood flow away from your uterus, and you want blood flow going to your uterus around the window of implantation. Okay. So now if you're doing like, you know, the leisurely bike ride through, you know, on the beach or whatever, that you're not hopefully getting yourself into those high intensity zones. You can take a nice leisurely bike ride. Okay. But a spin class is meant to get you into the high intensity zones, burn fat, blah, blah, blah. Please, not after an IUI. Just take a leisurely bike ride along the beach, take a stroll.
Take a walk, do some yoga.
Just yoga. I mean, like high intensity exercise after an IUI, I just doesn't like it. It goes in a different direction of what we're trying to accomplish here.
Yeah, no, for sure.
Is there a doctor who handles reproductive immunology transfer protocols at IVFMD? We all do. Like we all believe in it. Like it's I mean, the majority of us, I think. I mean, I know South Miami physicians, we all look at, you know, the immune system, and our physicians, we all do, and our vocal physicians, most of our docs, you know, address the immune system and make sure that we don't feel it could be a potential issue for success. I mean, I don't know specifics, but again, I always do.
We've seen time clinically, you see it work. It's just hard to study pregnant women.
Your immune system is like on super high alert. You know, we give them the treatment, they get pregnant. Like,
yeah,
probably worked. But again, we don't have great data, which is again very, very frustrating from a doctor perspective.
Well, but who wants to be in the no treatment group if you did a study?
Yeah, exactly. So like, all right, we're gonna try it on 100 patients. You guys are gonna get treatment. You guys are. Let's see what happens. And problem. So if you find a patient who their blood says they have an elevated immune system, and then we're going to do this randomized trial, and we're going to say, hey, okay, you've got an elevated immune system, and we're going to transfer your very expensive embryo, and you have an elevated immune system. We're going to transfer your expensive embryo, but we're not going to treat you, and we're just going to see what happens. No. It's just especially treatment, again, you know, the benefits outweigh the risks. So I'm very proactive when the benefits outweigh the risks on thinking out of the box and trying to, you know, help patients with the different, when we've had different failures and different issues.
Yeah. Oh, we have such good questions. There were actually a few questions submitted earlier that maybe we can squeeze them in the last few minutes here of our live. With IUI and acupuncture success rates. And to me, IUIs are, I mean, you know, it's difficult.
IUI, okay. So let's everybody get realistic about IUI. Okay. When you come to a fertility clinic, your success rate in getting pregnant, whether it's 1 year, 2 years, 3 years, 4 years, 10 years, is 0. Okay. Per month. It's 0 because you're not pregnant. Okay. When we embark on a treatment cycle using maybe a medicated treatment like a Clomid or Letrozole, and we do IUI, okay, your treatment success is 10%. Okay. 1 in in 10 patients who do an IUI cycle, even with a great sperm sample, get pregnant. That's what it is. If you're over 40, it's 5%. Okay? That's what it is. Like, let's be realistic about it, okay? Because it's very frustrating for patients like, oh my God, the sperm looked great. The doctor said the sperm looked great. I'm ovulating. That looks great. I've got a perfect follicle. Why didn't I get pregnant? Success rate is only 10%. Okay? Like, that's just the truth. I mean, that's just the truth. You've got to be realistic about it. But when you look at it from a relative perspective, you were at 0.
Yeah.
10% is 10 times better, you know?
Yeah.
And if you're over 40, the chances of getting pregnant with IUI, I mean, realistically, it's 1 in 20 get pregnant, just 5%. Mm-hmm. So IVF is such a more effective treatment. The problem is, it's, again, for a lot of patients, it's very burdensome, it's very expensive, it's a lot to do, but it works. So I'm never opposed to trying IUI with patients, but I want them to realize that this is what it is.
I feel like when IUI works, it works like immediately.
It works
usually. It's like,
yes, it's going to work second or third cycle.
Yeah.
Like I had a really low sperm count. He was status post vasectomy reversal. Counts were low. I mean, this guy, we were inseminating like 1 million sperm, which is not ideal. I need at least 2 million to be at least enthusiastic about doing this. Okay. First cycle, the lady gets pregnant, and first cycle. Like, so if IUI is going to work, literally, it's going to work in cycle 1, yes. 2, and maybe 3. I mean, I'm not enthusiastic about cycle 3. I mean, I'll do it if the patient insists, but if it's going to work, it's going to work fast. It's not something that you do over and over and over again, because again, we have so much more effective treatments. And I said earlier, my job is to get you pregnant and send you on your merry way. Like, I want to get pregnant as fast as possible with the most effective, efficient treatments that there are. So, when we're talking about, IUI, it's like maybe acupuncture can enhance your whole fertility thing, relax you, make you get a better egg, make you have better blood flow. But the background success of IUI really is only about 10%. I mean, if you're in your 20s, maybe 15%, but that's pushing it.
I just was looking into a study with 2019. It was done. It was like a meta-analysis of all the IVF acupuncture studies, which they don't have a lot of IUI acupuncture studies, interesting, but they do have a lot of IVF. And so it kind of interestingly increased the success rates of women more who had failures prior to doing acupuncture and IVF. So they had actually a study where they improved it even more so in the patients who didn't have a favorable outcome prior to, which I think makes a lot of sense actually to me. But it actually improved clinical pregnancy rates by 28 to 32%, and ongoing pregnancy rates by 42%, and live birth rates by 30%. And this data, it's basically saying, those patients who had failed cycles, they did better than the ones who did acupuncture that, I guess, that didn't really need so much, or they had already good outcomes already, their high success rates, that sort of thing. And they said that the more treatments, over 10 to 12 treatments, they responded better than those who just did acupuncture the day of transfer.
Yeah, no, I definitely think that there's a cumulative effect to acupuncture. You can't just pop in on the day of the transfer. There's a preparation period for that.
Yeah. And someone asked the question, the frequency, because we always get asked, how many treatments do I need? Well, we try to do twice a week treatments that, at least 6 to 8 weeks prior to starting medications, if possible.
You have to think of acupuncture just like exercise.
Yes. And brushing your teeth.
You don't go to the gym once and are fit.
Right. No.
Okay. You have to continually drive the blood flow to the areas where it's needed, especially in endometriosis patients. Oh my God, I'm in love with acupuncture for endometriosis patients. I think it can make such a huge difference, trying to get things flowing where it needs to flow. But again, you can't just do one treatment. I mean, it'd be nice if you could, but you can't. It's you can't just go to the gym once and, hey, I'm fit.
Not magic, that's for sure. Yeah, it's not
magic, but it is. You have to look at acupuncture. I mean, and I take my chronic exercisers, okay? And I'm like, you have to stop doing this, and you need to go to acupuncture. You've been chronically diverting your blood flow to your heart and your muscles, okay? And your poor little ovaries and uterus are shriveling up because there's no blood flow, and you have to do the same thing you were doing in the gym with the acupuncturist.
That's a good way of looking at it.
right. I'm right.
Yes. Yeah. No.
I have to make things get back to get the blood go back to where it needs to go when you're trying to conceive.
Yeah. Yeah, definitely. I like massage too for that. And also it kind of gives you something to focus on, like, okay, I'm going to do this. This is my treatment plan. I've got some sort of like thing to do that I'm going to be doing. So there's, definitely a good mental boost to that as well, instead of just like, well, here goes the waiting period and here goes all my blood draws and all the needles and, injections and all those things. So something to look forward to, hopefully. It's something the needles are tiny too, so they're not bad. So, well,
anyway, 8:30. I think we've got to, again, the bulk of the questions, at least I think we got the ones that were submitted, a lot of the ones that were submitted earlier. Hopefully we've given some important information. If patients want to come and see us, again, Dr. Ellen Wood, I'm at IVFMD. We have our website. I'm in the Cooper City office. Dr. Duro, you're in Highland Gardens?
Yep, and Highland and Florida Complete Wellness. Or you can follow us also. I'm at FL Complete Wellness, and then Dr. Wood, you're at Dr. Ellen Wood, right? I think you're
Ellen Wood, yeah. I'm my social media managers. They're in grad school now, so I'm kind of. I love media managers. They're too busy.
I miss your video, your dances. I love that.
I've got one of my social media managers. She's very stressed as first year dental student, and then my other one is a second year medical student. So they do not have time to manage my social media anymore.
Hey, it's fine. I think it's great that you're putting information out there, and we're here for you guys. Anytime you need us, just reach out. We're going to be continuing our lives until we get tired of doing lives. But I think they're fun, and I love them. So
we're here to, again, my goal is help you get pregnant and send you on your merry way. Okay, bring me back baby pictures so I can coat my walls with it.
Yeah. Right. Awesome. Well, thank you, Dr. Wood. Thanks everybody for your questions.
Dr. Duro for answering them, and very, very, very great to see you again.
You too. Have a great night, everyone.
All right, good night.
Take care. Bye.